Let me begin by thanking the organizers of these awards for the foresight, for the thought to be able to put together a platform where we celebrate institutions, individuals who are giving their time each day to be able to ensure that we are inclusive in our workplaces, inclusive in our homes, inclusive in our communities. I'm here today representing the Cabinet Secretary of Health, Senator Mutahi Kagwe. He would have loved to be here today, but he could not make it. And he insisted, you must go to that event and you must represent me. And one of the reasons why that call to action was given to me is because in the Ministry of Health, when the minister came, before, and I can see people saying, what happened to her hair? It's been a while since you've seen me in the screens, fellow Kenyans, but it's still me. I'll assure you that. It's still me. It's still Mercy. I can see women nodding yes and some men going like, I'm not sure. Well, the hair aside, it's important to be inclusive, even when it comes to hair, right? Now, the reason why Waziri Mutahi Kagwe is so keen and has really demonstrated leadership in this area is when he came to the ministry, and I've been in the ministry for close to now 12 years, we did not have ramps all the way from the beginning of the gate. And the office that does disability certification was on 4th floor. The lifts, if you've been to the Ministry of Health, they've since been repaired. The lifts were always malfunctioning. And so for you to come to get your certification, you had to come with someone to help you, guide you, go through up the stairs, go downstairs to the prefab for you to get your certification. Now that has changed. And I challenge you all to come to the Ministry of Health. We've put in ramps, and it's important that I say this. I hope Waziri will allow me to say this. He's done that through his network as a CSR for the ministry. So there was no budget that came from Treasury for that work that he did. He used his networks, his connections, to ensure that we have ramps. We now have a disability center that is easily accessible. And so really this is an issue that he takes dear to heart. As I conclude my remarks, it is important in all the different spaces that we sit in that these considerations are put in place, not just for one particular cohort in the population, but for all cohorts. For mothers, we've had instances where we've had to put policies in place to ensure if a mother has a certain kind of disability, a certain kind of need, that is availed, even in the delivery room, where sometimes delivery beds need to be modified to take into account certain forms of disability. But this goes on even beyond the mother who may have that disability, into mothers who may need in the workplace. And I'm glad I'm seeing here Kenya Railways, my friend is here, there he goes. I would want to know, do you have a lactation room in Kenya Railways? Wow, we need to clap for Kenya Railways. That's fantastic. Which other organization is here? Prof. Kobia, I'll pick on you as a family friend. Do you have a lactation room in your organization? Unfortunately not, and maybe you forgot what even lactation means in your mature age. But it's important we put all these considerations into place as we talk about matters diversity, matters inclusion, matters inclusivity. Thank you.
Asante sana.